Hello, I'm David Hutton of Ophthalmology Times. The American Society of Cataract and Refractive Surgery is hosting a virtual annual meeting for 2020, and I am joined by one of its presenters, Dr. Cynthia Matossian, who is discussing real-world efficacy of dexamethasone intraocular suspension 9%, data from a refractive case study. Tell us about your presentation.
Thank you very much for inviting me. Dexamethasone 9% intraocular suspension is the only FDA-approved steroid for use at the conclusion of ocular surgery, David, where instead of burdening our patients with post-operative steroid drops, we can place a small spherule of this dexamethasone product with its proprietary properties into the eye at the end of cataract surgery, and then, or really any other intraocular surgery, it's not limited to cataract surgery, then we seal the incision normal way, and the patient does not have to use topical steroids. This helps with compliance because we know patients are notoriously bad at complying with whatever we ask them to do, especially in the cataract age group. Many patients are in their 70s, so they have concomitant diseases for which they have to take oral medications, perhaps other eye drops like for glaucoma. So they become forgetful. They may have physical and mental limitations for instilling the drops or adequately getting the drop successfully into their eye. So by placing this DEXYCU into the eye, it eliminates the steroid drop burden, I should say, from their post-operative regimen. And of all the drops, steroids tend to be the most difficult to adhere to because we taper it over several weeks. For example, from 4 to 3 to 2 to once a day over several weeks. And this kind of decreasing regimen confuses patients even more. As a result, placing this drug into the eye at the conclusion of the ocular procedure is very helpful to patients. So what our study looked at was the amount of cell and flare at day 8 and thereafter in the post-operative period, and what the IOP looked like in the post-operative period. Fortunately, there were no statistically significant IOP spikes in the postoperative period. At one day, there was a slight increase in the eye pressure compared to placebo, up to 21 or 22 milligrams of mercury. Thereafter, the regular medication, placebo versus DEXYCU, had an identical parallel pattern going out to 90 days. We did not see any long-term steroid responders to this slow release of bio-eroding spherule being placed in the eye. Moreover, the amount of cell and flare at day 8 in the postoperative period, 61% of patients had zero cell. Let's see, about 97% had no flare at all at day 8, meaning that it was very effective, absolutely addressed inflammation without the burden of postoperative drops. The take-home message is, if you want your patient to have an excellent cataract experience, minimizing the number of drops that we're asking them to use is key. It's perceived as very burdensome by the patient, even though we as eye care surgeons may not think of it that way. So use DEXYCU intraocularly at the conclusion of surgery to minimize the drop burden of steroids and enhance the patient's post-cataract journey.